Pitt State sees a spike in COVID cases on campus, and while campus health is testing for the flu and strep, the number of COVID cases are higher in comparison. KOAM's Melissa Alexis has more.
I have classmates, even instructors who have gotten sick.
With Pitt State students being back in shared living spaces, attending classes and social events, Pitt State's campus is seeing a spike in COVID cases.
One of my friends that I'm pretty close to had COVID last week. I was glad I didn't have it because then I wouldn't have to miss class.
Pitt State's Student Health Clinic is seeing a higher number of COVID cases compared to cases of other respiratory illnesses.
We have been testing for strep and flu and COVID, and mostly it's been COVID numbers. We have kids coming from here in the United States that are from all over and have probably been around other people that have been sick, and now they're coming here and mixing it up with our kids and the kids that are here in Pittsburgh.
Current CDC guidelines say if COVID symptoms are improving and the person has gone 24 hours fever-free without medication, they're cleared to return to normal activities. Taylor Panzer says these guidelines are beneficial so students don't miss out on class time.
On campus about 4 years ago when we saw the pandemic hit, and it was heartbreaking to have conversations with athletes, coaches, the sorority women and fraternity men about, unfortunately, we have to shut down the house or shut down games or practices.
All the precautions and the vaccines and all the awareness that we have now with COVID, that we don't have to miss out on life.
Panzer recommends that immunocompromised students, in particular, take extra precaution and are up to date on their COVID vaccination. Reporting in Pittsburgh, Melissa Alexis, KOAM News.
And for people who test positive for COVID, the CDC recommends preventing the spread of the virus by covering your mouth when you cough and washing your hands for at least 20 seconds.